Welcome to another episode of Talking Shit. Shit, of course, is an acronym for Straight Health Insurance Talk. My name is Matt Allen, and I'm here with Aaron Miller.
Howdy.
Aaron, what are we going to be talking about today?
Well, funny enough, we had a short that did pretty well on Facebook. I don't know if you know this, but we just started Facebook. Got over 900 views.
Ooh.
Had some comments, had some likes, gained a few followers. I think we're up to 4.
Damn.
And it was about a article of a man who wanted to receive a certain treatment, and he couldn't get that treatment through the process of his health insurance network. It was a managed care situation. And so I think today we're going to talk about managed care because it's a very underappreciated aspect of health insurance and a very misunderstood, or so there's just no understanding whatsoever. So we're going to talk about managed care and why you should care.
Ooh, that's a good one. That's the hook right there.
That's the hook.
I actually remember which article you're speaking about. So it's just I read this article, did a little talking head, breaking it down. So to recap, this gentleman, was it West Virginia? Where was he located? Georgia?
Yeah, one of those.
Somewhere. Well, those are pretty far apart.
One of those states in the United States.
One of those 50. Okay, but not Indiana. All right. So this gentleman, he got a very bad diagnosis. I believe it was cancer-related, and the prognosis was bad. This poor man, he was going to pass away from this, and he was a little bit older, and he was prepared for that. With his health insurance, though, he got approved for a treatment that would likely prolong his life, but it was going to be a painful one. It was going to have to do with chemotherapy, a lot of hospitalization, a lot of pain, a lot of quote-unquote suffering to prolong his life. And this procedure, this treatment, let's say it cost $50,000. And the health insurance said, hey, we're going to pay for this. This man talked it over with his physician and his family, and he decided against that. He preferred a different treatment that was less expensive than $50,000, would still prolong his life, but there wouldn't have been as much pain and suffering. And it may not have prolonged it as long as the initially approved treatment, but it was still a treatment for his condition at the hospital where his insurance was accepted. This man was denied that care by his health insurance company, even though it would save his health insurance company money because they had not pre-authorized that treatment of care. Enough time had passed, enough appeals had passed, where that treatment no longer would have prolonged this guy's life. So he ended up not getting either treatment. His life was greatly shortened, passed away without insurance having to pay either one. Now, the argument there is, hey, we're going to spend less money on a treatment for the same illness that you've already approved because that's what the patient prefers. How is that not also being approved?
Yeah, that preference piece, I think, is the one that stands out to me. It's like this guy wanted something and couldn't get it.
Right. And so what ended up happening is lawmakers passed some laws that say, hey, if the treatment is going to be, the same price or cheaper and it's still a treatment for that, and the other treatment already got approved, you just got to cover it. And I don't know if it's been passed yet, actually. I think it's just been proposed. But it's just a wild situation because if the alternative lower price treatment had been proposed first, it would have been approved. Because it was actually saving the health insurance company money. But because of the bureaucratic nonsense that the Affordable Care Act has created with this managed care system, the guy was on an Affordable Care Act plan, he had to wait for approval before the hospital would do that procedure because they needed to know they were going to get paid before performing the treatment.
So that's the approval. It's like, hey, I know I'm going to get paid. I'm the insurance company. Before I approve something, I need to make sure it's coming back to me.
Exactly. And so it's a dance between the healthcare provider and the health insurance company when you're dealing with managed care because there are routine procedures of care based on all these markers that a patient is showing. So then the healthcare provider has to say, hey, we're going to do this procedure because of this, and this. Is it approved? Then the health insurance company looks at their chart and says, well, if he's got this, and this, we do approve this procedure, but not this one or this one. And this one we do approve as well. And so they just want to make sure they're getting paid. That is what managed care is like, where the hospital will not act until they've received this pre-authorization, pre-certification, and they will only grant that. The health insurance company will only grant this pre-authorization if they get the appropriate medical information, diagnosis codes, show that other types of treatment have been ineffective. They even ask for that. So it's just this big bureaucratic nonsense while the patient's sitting there in the hospital bed going, I just want to feel better.
Just give me something.
Like, I just want some health care. I have health insurance. I went somewhere that's in network. What's the big hubbub?
So it feels like an illusion of access, right?
I mean, they'll let you in.
Sure. Okay.
They'll
let you in.
If you're in network, they'll let you in. But then, your certain levels have to hit, your cholesterol has to hit a certain level before they're going to approve this cholesterol medication. And then you need to use that cholesterol medication and show that it hasn't lowered your cholesterol enough to be able to go to the higher priced cholesterol medication. And then you have to show that one doesn't work. So then the highest priced one gets approved. And so you have to jump through these hoops that say, before we're going to approve your knee surgery, we have to do 3 months of physical therapy and show me that we can't just PT our way out of this, that you actually need the surgery.
Interesting.
That's what managed care is. So a lot of people assume that that's just the way American healthcare is.
Yeah.
It is not just the way American healthcare is. That is the way American healthcare is when you're doing managed care. So think the government getting involved. This is the Affordable Care Act we're talking about. These are the Medicare Advantage supplements that we're talking about. This is Medicaid run through the state government. This is VA coverage for our veterans. All of these things are managed care. And I'm not necessarily saying they shouldn't be doing something to try to manage the care, because it does need to make sense financially.
Right.
But having the government in charge of this has created a bureaucratic swamp and mess. And unfortunately, in the guy from the article's situation, he ended up passing away early.
Yeah.
Because of this. And that shouldn't be.
So it's working your way up the ladder to receive the treatment that works best. So they're just trying to keep costs low, still looking to help you, right, with whatever the diagnosis is or whatever you're treating. But, you can't just jump in the Ferrari right away. You got to work your way up. You got to get into the, next vehicle that could potentially take you there.
Yeah, you got to crawl before you walk, before you run. And, 12 physical therapy sessions is going to cost the health insurance company way less money than a surgery. And so they want to see that didn't work, and then they'll approve the surgery. Well, most times physical therapy is not going to work in situations where an orthopedic surgeon has said, hey, you need this surgery.
Right.
They know what they're talking about. The insurance company will eventually pay more money because now they're paying for the PT and the surgery.
Yeah.
But a lot of these situations, the insurance company is, hopefully the PT fixes it, or hopefully this problem just goes away.
People forget you didn't go to all 12 PT sessions. You didn't follow up.
Yep.
You learned to deal with it.
You didn't do what you needed to do to get the surgery approved. And so we need to keep coming back, though. That is only when you have managed care health insurance, managed care Medicaid, managed care Medicare Advantage, managed care VA coverage. That is not how healthcare and health insurance has to work. It just simply isn't.
Yeah, so where does managed care not come into play?
Private health insurance plans, cost-sharing programs, and some of the really nice PPO-style plans that you can get through your job where you don't need referrals to go see specialists, where they are trusting the doctors to make the right prognosis, to offer up the right diagnosis, and then perform whatever procedures need to be performed. So let's take, for example, one of our clients. She has a private health insurance plan and she has a cost-sharing program. Okay? She has both.
Got it.
Because the private health insurance plan has no network restrictions, doesn't require any pre-authorization or pre-certification, meaning you can go anywhere and get anything done, okay? But the drawback to this private plan is it's something called a limited benefit plan. So her particular plan was going to pay up to $250,000 on those things. Okay. She was on an older plan. Those limits now, had she taken it out today, go up to $1 million. So pretty good plan. She needed a heart surgery. She had congenital heart disease through her family. She had been prolonging it and putting it off, but finally she's like, enough is enough. So she went to a hospital. She was there 10 days. She got a full heart surgery, valve replacement, got all the bells and whistles. She never once needed the healthcare provider to contact the health insurance company to say, is it okay if we do this? Like, are we going to get paid? Her plan said, if you have heart disease and you go get something done, you will get paid.
I mean, you're basically trusting professionals to be professional at that point.
And not limiting the things that they can do for care.
Yeah.
A lot of these medical providers hate working with insurance because they get put into a box. They can see what needs to be done with this patient because they've spent time with this patient. They're sitting there poring over the charts and the lab results and the blood work. They're having conversations with this patient. But unless it's hitting certain marks and the numbers are all lining up, the health insurance company, when you're dealing with managed care, is going to say, no, they're not sick enough for us to approve this.
Wow.
Their symptoms aren't bad enough for us to approve this. Whereas if you go the private route, they simply said, oh, you're in the hospital 10 days? Here's the benefit for that. Oh, you had a heart surgery? Oh, my God, it was due to heart disease. Oh, here's your benefit. And so she ended up owing, between her private health insurance and her cost-sharing plan, which we can get into how that works together, but neither one of them requires any sort of pre-authorization or pre-certification. She ended up owing $5,000 for that. She was in the hospital for 10 days. She got to go exactly where she wanted. The doctor never got told which procedure to do or what to do. And it was over $250,000 bill. It was like $263,000. She walked out of there owing $5,000. And it's had nothing to do with managed care. It was, did you need something done? Okay, you can go wherever you want, and this is what you'll owe, and we don't need a pre-certification for this.
Wow. So it's freedom of movement, freedom of choice is what people are missing out on when they are in these managed care systems.
It's all of that, but it's also the freedom to get the right care.
In a timely manner.
In a timely manner.
Yeah.
If the doctor goes, oh my gosh, you need this. I've seen this 1,000 times. Yeah, you haven't progressed to the point where this is life or death.
Yeah.
Why don't we do it before that? Why don't we prevent us from getting to the life or death situation and have health insurance pay on it? So there are options out there. And we always say, if you are someone of means, if you have the ability to afford a private plan, you should absolutely be moving away from these managed care systems.
Yeah.
So if you're on Medicare, run as fast and as far away as you can from Medicare Advantage, because it's going to say you got to go to this guy to see that girl, to see this guy, to get that thing approved. There's going to be waiting periods. There's going to be these lengthy gaps in care, and then only certain things are going to be approved. When you go on the individual side and you're under 65, that's going to be the Affordable Care Act. The Affordable Care Act is going to say you got to see this guy to go to that gal to get this thing approved. You got to take these 10 physical therapy sessions before we're going to approve this. That's all managed care because they have to control their costs somehow. The Affordable Care Act has done wonders for a lot of people. But when you have a health insurance program that covers everyone for everything for an unlimited amount of money day one, that health insurance company has to control their costs somehow because you have disallowed them from calculating risk, which insurance is based on. Risk is the bedrock of insurance. Risk is. And so when you don't allow the health insurance company to calculate the risk anymore, they're going to start cutting corners in ways that are very detrimental to the people who have these health insurance plans. And that's going to be delayed treatment. It's going to be, you got to be approved for this, to be approved for that, to be approved for that. You got to jump through these hoops. Just a quick anecdote about the ACA. Like some woman who was our client got on one and she needed to see a specialist. I think it was a pulmonologist, maybe a dermatologist, one of the ologists. Okay.
Plenty of them out there.
She's like, hey, I got this HMO ACA plan. And it made sense for her at the time. They go, ooh, earliest we can get you in is 8 weeks. It's like, 8 weeks? Some people are actually happy when they go, wow, I only got to wait 2 months to see a doctor. But she was in a hurry. She's like, 8 weeks. This is a joke. Okay. She called back. She made the appointment, but then she called back because it was really bothering her. She's like, I don't want to wait 2 months on this. She called back and she goes, what if I just pay cash? What if I just don't run it through my insurance?
Oh.
They go, oh, we can see you next Tuesday. We got an opening.
They hate working with insurance that much.
They know they're going to get paid only a certain amount from the insurance because they have a negotiated contracted rate. And they know they're going to have to go through whatever hoops they are. Now, I'm not saying this is just uniform across all health insurance and all, medical professionals. But in this particular person's case, she's like, well, I'll just pay the $150 out of pocket for this doctor visit so I can go next Tuesday. And so to extrapolate that, you can have a private health insurance plan then that allows you to go to any doctor, any hospital, get payment for any type of surgery, procedure, doctor visit, blood work, lab work, whatever, and they don't need the pre-authorization or the pre-certification. So if we're looking for an ACA alternative, or we're looking for a managed care alternative, they already exist. The only issues with these is you got to be able to pay for them, which they're the same cost as a full-priced ACA.
Mm-hmm.
So they're already in the same ballpark of what millions of people are paying per month. But then there's no network restrictions, no pre-authorization, no pre-certification. It's fantastic. You just have to medically qualify for these, though. That's the other hang up with them. If you're a chronic, type 2 uncontrolled diabetic who eats McDonald's 3 times a day and this isn't going to work for you.
Right.
They're going to say, we're not covering you. You kidding me? So that's where the managed care aspect has to be the solution for that person. So stay healthy, get better coverage, freedom of care, freedom of choice, no pre-certification, no pre-authorization. This all exists. It's just most people don't know about it.
Yeah. Does managed care ever work well?
Well, it can. I mean, there are millions of people out there, and I've talked to them, and we have a lot of clients. A lot of people say, Matt, I don't really care about that. I want the cheapest health insurance.
It's a preference thing.
It's a preference thing. I want the cheapest health insurance, and I've been told this, as long as somebody will take it, I don't care. And to me, I say, well, great. We can just do an Affordable Care Act plan. It's super simple. You don't have to pass through underwriting. Here's the plan. Here's how it works. Here's where you go. They don't mind maybe a slight delay in treatment. They don't mind having to change their doctor. They don't mind having to go to their primary care to get a referral. They just don't mind. And if they don't mind, I don't mind. I don't care.
Right.
But for me personally, I know, and for lots of our other clients, if they had some sort of nasty diagnosis, they want to go probably get a second opinion, third opinion, fourth opinion. They want to, and my stepdad, he had some health issues a couple of years ago. He got second, third, fourth, fifth opinions because it was a major surgery. And he's like, I want to have a general consensus on this from some very intelligent people. And they all said the same thing. And so then he felt better. Yeah. And he picked the one that had like the highest ratings or whatever to do this procedure. And now he's fine. He's perfectly healthy. But it helped relax some of that stress. Had he been on an HMO, managed care, Affordable Care Act plan, it would have been go to your assigned primary care physician.
Yeah.
That person needs to refer you to a specialist. And if you get referred to that specialist, who knows how long it'll take to get in. But then it's what that specialist says.
Yeah. No, that's a good point. You have to take their word for it.
I mean, I think you can fight for second opinions or third opinions, but that's not the norm.
Right. You're going to wait another 8 weeks to get into another specialist to.
Now, maybe, okay, or maybe the ones that get sensationalized are the outliers.
Sure,
it very well could be the case. I'm not saying there's some sort of widespread pandemic of nobody getting their health care, but we have an article of a guy dying before his treatment got approved.
Right,
when a more expensive treatment was already approved. Maybe there's some issues here with the managed care.
Probably
and
is.
So for the people who can avoid it financially and health-wise, they just should. You got to get out of there.
Yeah, and especially for the early retirees who maybe they were on a really nice PPO plan, and they have this expectation of how health insurance should work, the type of freedom that they should have. And, maybe the ACA is the only thing they've heard of. Like, it's going to be much different than what they're expecting.
It can be.
Yeah.
I'll tell you a story about a woman who retired early. Her husband carried the health insurance for them. He turned 65 and said, I'm done working. I'm going on Medicare. And his wife, 62, and she had pre-existing conditions. She had like these severe migraines, like debilitating ones.
Oh.
And it was due to some injury she had in her neck. I think it was a car accident, something like that. And the only medication that would alleviate and prevent her migraines was a name brand. It was a specialty med. It was $800-900 a month, full price.
That's like tier 4, isn't it?
That's you can barely get more expensive than that, unless it's a very boutique specific medication. So, $10,000 a year, and he was a retired I think eye doctor or something. They had money, they could have paid that, but I spent time with her at her dining room table, and because they were used to PPO insurance for decades. And she had to go through all the rigmarole of trying different medications to finally find the one that worked for her. Okay?
She had done the work.
She'd already had, because she'd been having these migraines for decades. So she went through all of it. She's got her specialist. She's got her primary care, everything. So I sit down with her, and anytime you're going to look at a marketplace plan, if you have a name brand expensive drug, you got to make sure it's in the formulary. Because, they cover pre-existing conditions. But if your drug isn't in their formulary, they're not going to pay for it. So we spent some time. We found an ACA plan with her primary care, her specialist, her neurologist, and her medication. It was all in there.
Yeah.
And I was like, all right, man, did a great job. Okay, she's going to be super happy with this. I was feeling good. And she calls me like 6 weeks later, and she goes, we got a problem. Like, come on. No, we don't. I double and triple checked all that stuff. They covered that prescription. It was part of their formulary. But their way of doing their managed care said, but there's a $4 a month migraine med that exists. We're going to want you to go ahead and try that.
Had to re-climb the ladder.
Before we're going to approve this $800, if the $4 one doesn't work, and the $20 one doesn't work, and the $100 one doesn't work, we'll approve the $800 for sure. And she went back to them and she goes, I already did that. I already did all of that. I've been doing it for decades. I'm telling you, this is the only one that works. And you cover it. And they said, but you haven't tried it while we've been insuring you.
That's ridiculous.
She went back to her provider. She went to her specialist. She went to her primary care. She got all the data. She got all the information that said, we tried this, it didn't work. We tried this, we didn't work. She got like a doctor's note saying, this doesn't work for my client. This one does. And they said, no, we understand that, but we're gonna approve that $4 one first. Now, I haven't had this happen with a lot of clients over 10 years of helping with this.
It's crazy.
But the fact that it can happen, it has happened. She ended up just canceling everything. She's like, I'm not dealing with this. If this is how the company's going to work, I don't want to deal with them. I felt terrible because I was just working within the system that we have.
Sure.
I thought I did a great job, and she ended up getting denied on this. So she went back to her husband's old employer and was like, can I please just keep Cobra? Can I just be on Cobra? And they allowed her to get on it, which is great. And then she could keep her medication that worked for her. But that's the type of stuff that you're going to find in managed care.
Wow. That's nuts.
It's so nuts. And that's not health care.
No, that's managed care.
That's managed care.
Yeah. And so when you say the ACA as a whole is mostly managed care, is that, HMO is Health Maintenance Organization, right? But the other two, the EPO and the POS, those are also managed care?
Oh, yeah. It all is. Well, think of the health insurance company. Like, let's do an analogy to auto insurance. Imagine auto insurance companies had to take every driver, no matter the expense of the car, no matter how many miles they drove, no matter where they parked it at night, and no matter 8 DUIs or 0, 3 hit and runs or none, 1,000 points on your driving record or 0. If they charged everybody the same amount and covered all your auto insurance expenses for an unlimited amount of money, what would the auto insurance company have to do?
Go out of business.
In order to stay in business, though,
Right.
they'd have to control their costs somehow. You know what they'd be doing? They'd be going to different auto body shops, and they'd go, okay, you're an approved vendor, you're an approved vendor. This car has to be at this damage level, though, before we're going to do anything. They'd be getting cars just safe enough to be back on the road.
And yeah.
And saying, get on out there. Nope, this car's drivable. You kidding me? They'd be using old parts. They'd be recycling stuff. They'd be going to junkyards, because if they have to cover all that stuff, they got to control their costs somehow. So not only would they have to be raising rates, raising deductibles, but they'd be skimping on the actual repairs of your car.
The treatment.
They would never total a car at that point.
No.
They'd be slapping zip ties and duct tape on everything just to get it hey, it runs. Look.
Yeah. And not to mention the auto body shops dealing with all that to even get a car back on the road.
Imagine being a mechanic and you have all this guaranteed business if you accept this auto insurance.
Yeah.
It's guaranteed. You know exactly what you're going to get paid, but you'd rather work on other cars, wouldn't you? Wouldn't you rather deal with the people where you can put the right parts in there, you can use the right things? Wouldn't you want to see them on Tuesday instead of eight weeks from then?
Yeah.
I would. Because I'd be able to do my job better.
Absolutely. I mean, I get to use the tools I want to use. I get to use this new knowledge that has come out. I get to be the best mechanic I want to be.
And that person is going to be happy with their service.
Yeah, they would.
So it's kind of a crazy analogy. It's not apples to apples, but it's close enough that that's what happens in managed care.
Wow. And people don't realize this.
No, they don't. They look at their premium, they look at their deductible, they say, hey, I'm covered.
The higher the price, the better the plan.
Yeah, unfortunately.
Yeah, I was just looking up some other ways people talk about care coordination, medical management, utilization review. It's just other ways that they're controlling the way in which you use the healthcare system. It's just all those things. And so, I think the biggest piece of all this is stay healthy.
Well, stay healthy up to a point. A lot of people are trying to get value out of their health insurance. And that's one of the craziest things I think I ever hear is somebody complaining that they paid their health insurance premium all year, but I didn't even use it. And I'm kind of sitting there scratching my head yeah, that's a great thing.
Fantastic.
So you didn't get sick. You didn't get hurt. Are you complaining about that?
They are. I've seen them all online.
It's wild to me that you want to get value out of your health insurance. Do you call your homeowner's insurance guy at the end of the year and go, what the hell am I paying this premium for? I didn't even have to replace my roof or anything. What are we talking about?
If you just put all the money you spent on homeowners insurance into an index fund and just save it over the life of your home, I mean, you could just
absolutely
use
ridiculous
that to rebuild your home when it burns down.
All of these people saying, well, I just put all my health insurance premiums to a savings account and then I just pay for care. Yeah, you should always be just paying for your care. That's not what health insurance is for. Health insurance is to make sure you don't go broke. Because at the end of all of these posts I hear, well, don't come at me with some catastrophic thing. I'm not worried about that. That's the only thing you should be worried about. That's it. That's what insurance is for, is to prevent a catastrophic loss. Health insurance is not there to give you a copay on your ADHD medication. That's not what it was designed to do. It's so you don't have to take out a second or a third mortgage on your house because your kid got leukemia. That's what health insurance is for. So if you strip it down to that and you get outside of managed care and you have a private plan you can take anywhere that doesn't require pre-authorization or pre-certification, do you know how much money you can save on your premiums?
Quite a bit.
Quite a bit. And then you're still protected for the large medical expense, the unforeseen thing.
Yeah.
That's what insurance is for. And so we just need a total reframe of health insurance and what it should be and what it can be. when it's utilized within our American healthcare system, we need a total reframe from people, because everybody's just stomping their feet and complaining about how it is right now. And if you are sitting in the managed care system, you should be pissed.
Yeah.
It does suck. It is expensive. It is inefficient. It is not healthcare. It is sick care. They want you in the system. They want you utilizing it. That's why you're programmed to want value out of it. That's ridiculous. You should never want to be involved in the healthcare system unless you have to be. And that's all your coverage should cover. You're going to save money, have more flexibility, not required some sort of pre-authorization. That's how we can still win in the American healthcare system.
Yeah. That's all I have on my end. I mean,
Yeah.
I think that's a pretty clear depiction of what managed care can look like in practice. I mean, we're not doctors. We don't deal with this on a day-to-day basis, but I'm glad I'm not.
Yeah. I've talked to many doctors who got out of med school. They signed up with some big hospital system, and they get disillusioned fast because they thought they were going to be caring for patients, but they got to see 30 to 40 a day. They get 6 minutes with their patient. They're sitting there in the EMR, the electronic medical records, just typing in symptoms and putting out prescriptions. It's a numbers game there. They're just trying to flip them.
Yeah.
Get into the private. Get into the private health insurance. Get into the no network restricted, no pre-authorization required. Get some actual health care. It's possible.
That is the managed care system and why you should care.
Hey.
Do the outro.
This has been another episode of Talking Shit. Shit, of course, is an acronym, Straight Health Insurance Talk. This has been Matt Allen and
Aaron Miller.
See you guys next time.